Hello everybody, thanks for taking the time to at least start watching this video. Today's the 29th of July and we're all back in that fear and anxiety mode, even though down here near Geelong we're out of the so-called stage 3 area. My observation and feeling and discussing with friends, family and clients is that we're very much acting as if we're in stage 3 anyway. I think the vast majority of people are social distancing, doing the things that are somewhat sensible. But I probably feel that there's more fear, there's more concern this time round. I think the shock and awe of March, April has passed us by, and we drifted into some complacency in the community, and this is just a global statement. So, this time round is very different. This COVID-19 virus is running around the community through community spread, highly politicised virus. So setting that aside, I guess we've had a lot of meetings here at Freedom Physio and Pilates. We brought in an amazing physiotherapist. We spent 2 or 3 years interviewing and trying to find the right person. So Stuart's taken a lead on infection control. We've really dug down and looked at not just what the guidelines are from the Australian Physio Association or the government. We've actually increased the standards here. Wearing masks, gloves, social distancing is paramount here. We've reduced the number of people coming through the clinic. Unfortunately, we've had to put the casual Pilates studio users on holiday until the end of August when we review that. So what we're trying to do is we're doing our utmost to minimise the risk to you, the client, the potential client, and obviously our staff as well, because we are open, we are consulting with patients, we are seeing patients face to face, we are performing in-rooms physiotherapy, we continue to train in the rehab gym, we continue to train one-on-one with clinical Pilates as well. The biggest change has been we're just not allowing casual use. So, and as hard as what that has been for some of our members, it's just something that was required. So, the biggest change again we see with the the second wave of COVID-19 is obviously the fear in the community, and rest assured that we are holding ourselves to the highest standards in terms of hygiene. We are acutely aware of minimising risk. So you can never say it's 100% safe to go anywhere and do anything, but just rest assured that our standards here are higher than you'll find in a lot of places. And that's what we're aiming to do, aiming to keep ahead of the curve. So we are here today and tomorrow, next month, next year, to help people make better decisions about their physical health. And we're here to help people improve their physical well-being, and we're certainly not going anywhere. So that leads me to the next thing. Okay, so we are here. You can book online. You can call us. You can carry out a normal physiotherapy consultation. Not a problem. But I think there's a very powerful pivot and a powerful shift going on in the world and the way in which people interact with service-based businesses. So one of the most interesting things about the last phase where we had a bit of a slowdown because of fear of the virus was that nobody was particularly interested in telehealth. So being a practice where we pride ourselves on our manual therapy skills, there's a bit of a perception that physiotherapy is all about manual therapy, touching people, mobilisation, massage, manipulation, that sort of thing. Whereas really at the end of the day, I guess what we have to do, and as important as what manual therapy is, as important as what hands-on treatment is, we all need to take stock and understand that we could be dealing with this virus for the next 2 years. You know, if today someone said and has done the work, and here's a vaccine and it works, this is fantastic, we can treat people with it, we can use it to prevent COVID-19, it would take 4 years to make enough doses to inoculate the world. So to a degree, depending where you are, where you live and how lucky you are and what country you're in, you know, even if there are useful vaccines available, it's going to take a long time. And I think we'll probably change the way we live for quite some time. There's going to be profound economic changes. And we, as a people, need to get used to a different way of doing things. So what I'm trying to say is that if you have spinal pain, if you have an injury, if you're very tense, stressed, and you're getting neck pain and tension, headache, and these sorts of things, the types of things that we help people with a lot, you don't necessarily need to have hands-on treatment to have a profound benefit. One of the things that we have always underrated in physiotherapy is advice. We can successfully listen to you via the various mediums, be it telephone or preferably FaceTime audio. Zoom's more for classes. I like FaceTime audio. I reckon that's pretty cool. You can really get to the bottom of a person's problem list by listening, by speaking. You don't necessarily need to perform a hands-on assessment. So in today's climate, what we need to do is educate and help you understand that you can get benefit from giving us a call, booking a telephone consultation, booking a FaceTime audio consultation via this thing called telehealth, and get enormous benefit. I guess it's a little bit like having a virtual coach. There are some very, very common and debilitating conditions that we can help you with over the internet, over the telephone, without you actually having to come and see us. And we're really happy to speak about this. So conditions like back pain, any spinal pain, neck pain, shoulder injuries, shoulder pain, knees, the things that we most commonly see can be really successfully managed via remote control. We have a YouTube channel. So you just go onto YouTube, look up Freedom Physio and Pilates. You will see a lot of videos, a lot of talks like this that will help you improve your health. We post a daily or almost daily Facebook video just with some basic floor exercises just to keep people moving and active within their confines. And what we're asking for is feedback, because I really believe that the future is going to be virtual, that health services that stay with the old I sit here, you book in, you see me sort of model, it's not going to work. We can help so many more people by embracing technology, by embracing the digital age and getting things out there. And that's what I'm saying is that last time round, hardly anyone took up this virtual process. I believe it's the future. And at this stage, in terms of if you have a problem that you want help with, that if you have a problem related to your physical health, injury, there's a lot you can take away by speaking to an expert. And our starting point will be we'll do it for free. We'll give out our time for nothing. Just book a 15-minute phone call, and it does not obligate you to doing anything. You don't have to come and spend money. But what we want to do is we want to give you the value proposition that there are things that you can do with good advice, and that's what we're here for. We're here to coach you specifically about your unique situation and help you get on top of things and improve the quality of life, I guess, through getting really, really good advice. So I hope this helps, and I certainly invite you to contact us in any way, because trust me, when the phone stops ringing or it slows down a little bit because people are scared, I've got loads of time to help people via other mediums, and I passionately believe I can do a lot more through listening and speaking than I ever can with my hands. So thanks for watching this. I hope you made it to the end of the video. Any feedback about these videos that I'm doing, I'd greatly appreciate it, because it's going to take a long time for me to get good at them, and without feedback, I can't learn. Thank you.